Look down at your feet right now. Go ahead. I'll wait. Now, what if I told you that those feet, the ones you walk on every single day, could be sending you urgent warning signals about one of the most important organs inside your body? And no, I'm not talking about your heart. I'm talking about your liver. Here's what most people don't realize. Your liver doesn't have pain receptors. That means it could be struggling, damaged, even failing, and you might not feel a single thing in your abdomen. But your feet will tell you the truth. The swelling you blamed on old age, the itching that keeps you up at night, the strange color changes you thought were nothing. Those aren't just getting older problems, my friend. Those could be your liver crying out for help. Stay with me for the next few minutes. What you learned today could genuinely save your life. Welcome back to the channel. And if you're new here, welcome. We're so glad you're here. On this channel, we focus on health information that matters most for people over 60. Real information. No hype, no scare tactics. Just the truth you need to take control of your health and live your best years with confidence. Now, today's topic is one that doesn't get nearly enough attention, and honestly, that concerns me deeply. Your liver is the largest internal organ in your body. It sits right under your rib cage on the right side, and it performs over 500 essential functions. 500. It filters toxins from your blood. It produces bile to help you digest food. It stores vitamins and minerals. It helps regulate your blood sugar. It even plays a role in your immune system. And here's the thing. When you're over 60, your liver has been working non-stop for 6 decades or more. That's 60 plus years of filtering medications, processing foods, handling environmental toxins, and dealing with everything life has thrown at you. Over time, that takes a toll. The problem is, liver disease often develops silently. Many people don't experience obvious symptoms until the damage is already significant, and by the time you feel pain or notice dramatic changes, the disease may have progressed to a serious stage. But here's the good news, and this is why I'm so passionate about sharing this with you today. Your body does give you warnings. You just have to know where to look. And one of the most surprising places your body sends those early warning signals is your feet. So today we're going to walk through 8 specific signs that can appear on your feet when your liver is in trouble. Some of these will surprise you. Some might even describe something you're experiencing right now. And for each one, I'll explain exactly what's happening inside your body, why it matters, and what you should do about it. Let's get started with sign number 1. Sign number 1, persistent swelling in your feet and ankles. Now, I know what some of you are thinking. My feet swell all the time. I've been dealing with that for years. It's just part of getting older, right? And yes, mild swelling can happen from standing too long, eating salty foods, or even just from the natural aging process. But here's what many seniors don't realize. There's a specific type of swelling that can signal serious liver trouble. When your liver is damaged or not functioning properly, it struggles to produce a protein called albumin. Now, don't worry about remembering that word. What matters is understanding what this protein does. Think of albumin as a sponge inside your blood vessels. Its job is to hold fluid inside your bloodstream where it belongs. When your liver can't make enough of this protein, fluid starts leaking out of your blood vessels and pooling in your tissues. And because of gravity, where does it go? Straight down to your feet and ankles. This type of swelling is called edema, and it has some telltale characteristics. If you press your thumb firmly into the swollen area and hold it for about 5 seconds, then release, and you see an indentation, a dent that stays there for several seconds before slowly filling back in. That's called pitting edema, and that's the kind of swelling that should prompt a conversation with your doctor. Many seniors dismiss this because they assume it's a heart issue or just poor circulation. And it certainly can be those things, but liver-related edema is more common than most people think, and it's one of the earliest visible signs that something is wrong. If your feet and ankles are swelling regularly, especially if it's getting worse over time, please don't just elevate your feet and forget about it. Mention it to your doctor and ask specifically about your liver function. Sign number 2. Itching on your feet that just won't go away, especially when there's no rash or visible skin problem. This one frustrates so many seniors because they go to their doctor, they look at their feet, and everything looks normal on the surface. No redness, No rash, no fungal infection, nothing visible, but the itching is relentless. It keeps them up at night. It drives them absolutely crazy. Here's what could be happening. When your liver isn't working correctly, it may not be processing bile properly. Bile is a fluid your liver makes to help digest fats. Normally, bile flows from your liver into your intestines and does its job. But when the liver is struggling, bile salts can build up in your bloodstream instead, and when those bile salts reach the tiny blood vessels near the surface of your skin, they cause intense, maddening itching. In plain English, it simply means itching caused by a bile flow problem. And it very commonly shows up in the extremities, particularly the soles of the feet and the palms of the hands. What makes this especially tricky is that many seniors try to treat it with lotions, creams, antihistamines, all the usual remedies for itchy skin, and nothing works, because the problem isn't on the skin, the problem is inside the body. If you're dealing with persistent, unexplained itching on your feet, the kind that lotions and creams don't fix, please bring this up with your healthcare provider. A simple blood test can check your liver enzymes and bile acid levels, and that can give you answers. Sign number 3, a yellowish tint appearing on the skin of your feet, particularly on the soles. Most people have heard of jaundice, that yellowing of the skin and eyes that signals liver problems. But many people only associate jaundice with the eyes and face. They don't realize that the yellowing can appear anywhere on the body, including the soles of your feet. Here's why this happens. Your liver is responsible for breaking down old red blood cells. During that process, a yellow substance called bilirubin is produced. A healthy liver processes bilirubin efficiently and sends it out of your body through your stool. But when the liver is damaged, bilirubin builds up in your blood. And as those levels rise, your skin starts to take on a yellowish hue. Now, for people with lighter skin tones, this may be easier to spot. But for those with darker skin, the yellowing might be most noticeable on the soles of the feet, the palms of the hands, and the whites of the eyes. Here's a quick check you can do at home. In good, natural lighting, near a window during the daytime, look at the soles of your feet. Compare them to what they normally look like. If you notice a yellowish or even slightly orange tint that wasn't there before, that deserves attention. And let me be clear about something. Jaundice is never normal. If you see yellowing anywhere on your body, it's a sign that something is happening inside your liver that needs to be evaluated. Don't wait on this one, friends. Make that appointment. Sign number 4. Red, warm, or burning sensations on the soles of your feet. Have you ever taken off your shoes and socks and noticed that the bottoms of your feet look unusually red, almost like they're flushed or sunburned? And maybe they feel warm to the touch, or you experience a burning sensation, especially at night? This condition is actually well documented in liver disease. When it appears on the palms, doctors call it liver palms. But the same thing can happen on the soles of your feet. So, what causes it? When your liver is compromised, it can't properly regulate certain hormones, particularly estrogen. Yes, both men and women have estrogen in their bodies. When the liver can't break down excess estrogen efficiently, those elevated hormone levels cause the small blood vessels near the surface of your skin to dilate, to widen, and open up. This increased blood flow creates that reddish, flushed appearance and that warm or burning feeling. Now, many seniors chalk this up to poor circulation, neuropathy, or just tired feet. And those are certainly possibilities. But if you're noticing persistent redness on your soles that doesn't go away with rest, especially if it's accompanied by any of the other signs we're discussing today, your liver could be the underlying cause. Pay attention to this one. It's subtle, but it's significant. Now, before we continue to sign number 5, I want to pause for just a moment. If you're over 60, or if you're watching this because you're caring for an elderly parent, spouse, or loved one, this information could genuinely be life-saving. Liver disease is one of the most underdiagnosed conditions in older adults because so many of its early signs are mistaken for normal aging. So here's what I'd like to ask you. If anything we've discussed so far sounds familiar, the swelling, the itching, the color changes, the burning, please don't ignore it. And please share this video with someone you care about. You never know whose life you might help protect. Also, if you haven't already, go ahead and hit that subscribe button and tap the bell so you never miss our weekly health updates designed specifically for seniors. We're building a community here of people who believe that knowledge is the best medicine, and I'd love for you to be part of it. All right, let's keep going. We're halfway through, and the next 4 signs are just as important. Sign number 5, spider veins appearing on your feet and ankles. Now, spider veins are those thin, web-like clusters of tiny blood vessels that you can see through the skin. They look almost like little red or purple spider webs, which is how they got their name. Many people develop spider veins as they age, especially on the legs, so it's easy to dismiss them. But here's what many people don't know. When spider veins start showing up on your feet, ankles, and lower legs, especially if they seem to be multiplying or appearing suddenly, it can be connected to liver dysfunction. Remember how we talked about the liver's role in regulating hormones? When the liver can't properly process estrogen and other hormones, those substances circulate at higher levels in your blood. This causes small blood vessels called capillaries to dilate and become visible through the skin. The key difference between regular age-related spider veins and liver-related ones is the pattern and the timing. Liver-related spider veins often appear in clusters. They may have a central red dot with tiny vessels radiating outward like the legs of a spider, and they tend to develop relatively quickly rather than gradually over years. If you're noticing new spider veins on your feet or ankles, especially in combination with any other signs on this list, it's worth having your liver function checked. Sign number 6, numbness, tingling, or a pins and needles sensation in your feet. This is one that so many seniors experience, and almost everyone assumes it's diabetes-related neuropathy or just poor blood flow. And yes, those are the most common causes. But there's another cause that often gets overlooked, and that is liver damage. When your liver is impaired, toxins that it would normally filter out of your blood start to accumulate. These toxins can damage the peripheral nerves, the nerves in your extremities, particularly your feet and hands. In simple terms, it means nerve damage caused by liver problems. The symptoms feel very similar to diabetic neuropathy. You might feel tingling, numbness, burning, or a sensation like your feet are falling asleep frequently. You might notice that you have trouble feeling temperature changes or that you're less aware of pain in your feet. Here's what concerns me about this symptom for seniors. When you lose sensation in your feet, you're at a much higher risk for injuries you don't notice. Cuts, blisters, sores that can become infected. And if your liver is already compromised, your body's ability to heal those wounds is also reduced. It becomes a dangerous cycle. So if you're experiencing numbness or tingling in your feet and your doctor has ruled out diabetes, or if you have diabetes but the neuropathy seems worse than expected, ask your doctor to check your liver function. It could be a missing piece of the puzzle. Sign number 7. Severely dry, cracked heels that don't improve with moisturizers. I know this might sound like a stretch, pardon the pun, but hear me out on this one, because the connection is very real. Your liver plays a crucial role in absorbing and storing fat-soluble vitamins. These are vitamins A, D, E, and K. When your liver isn't functioning properly, it produces less bile, which means your body can't absorb fats efficiently. And when you can't absorb fats properly, you become deficient in these essential vitamins. Vitamin A and vitamin E are particularly important for skin health. They help your skin stay hydrated, elastic, and able to repair itself. When you're deficient in these vitamins because your liver isn't doing its job, one of the first places you'll notice it is on your heels. The skin on your heels becomes excessively dry. It cracks. It may even bleed. And no matter how much lotion you apply, no matter how many foot soaks you do, it just doesn't seem to get better. That's because the problem isn't on the surface. The problem is an internal nutritional deficiency caused by poor liver function. Now, dry heels are extremely common in seniors, and most of the time, they're caused by dehydration, aging skin, or environmental factors. But if your cracked heels are severe, persistent, and resistant to every treatment you've tried, and especially if you're experiencing other symptoms on this list, it might be time to look deeper. A comprehensive blood panel that includes liver function tests and vitamin levels can help clarify the picture. And finally, sign number 8. Easy or unexplained bruising on your feet and lower legs. Do Do you find bruises on your feet or ankles and you have no memory of bumping into anything? Do you notice that even the slightest contact, the edge of a coffee table, a shoe rubbing the wrong way, leaves a dark bruise that takes weeks to fade? This is one of the most telling signs of liver trouble, and here's why. Your liver produces proteins called clotting factors. These are the substances in your blood that help it clot when you get injured. They're what stop the bleeding when you get a cut, and what prevent bruises from forming after minor bumps. When your liver is damaged, it can't produce enough of these clotting factors. As a result, your blood doesn't clot as efficiently, and you bruise much more easily. For seniors, this is particularly important to pay attention to because easy bruising is often dismissed as a side effect of blood thinners, aspirin, or simply aging skin. And while those factors can contribute, unexplained bruising that's getting worse over time should always be investigated. Look at your feet and lower legs right now. Do you see bruises you can't explain? Are they darker than you'd expect? Do they seem to take forever to heal? If so, and especially if you're experiencing other signs we've discussed, a liver function test is absolutely warranted. Now, I don't want to leave you feeling worried or anxious. That's never my intention. My goal is to arm you with knowledge so that you can have informed conversations with your doctor and catch potential problems early when they're most treatable. So let me share some practical advice and steps you can take right now to protect your liver health. First, and most importantly, if you recognized yourself in 2 or more of the signs we discussed today, please schedule an appointment with your doctor. Ask specifically for a liver function panel. It's a simple blood test. It's covered by most insurance plans, including Medicare, and it can reveal a tremendous amount about how well your liver is working. Second, take a close look at your medications. Many common medications that seniors take, including certain cholesterol drugs, pain relievers like acetaminophen, and some antibiotics, can strain the liver over time. Never stop taking a prescribed medication on your own, but do have a conversation with your doctor about whether any of your medications might be contributing to liver stress. Third, be mindful of alcohol consumption. I'm not here to judge anyone's choices, but the reality is that as we age, our liver becomes less efficient at processing alcohol. What you could tolerate at 40 may be too much at 65. Even moderate drinking can affect liver health in older adults, so it's worth discussing with your doctor. Fourth, focus on a liver-friendly diet. This means plenty of leafy green vegetables, fruits, whole grains, and lean proteins. Foods like garlic, turmeric, green tea, and cruciferous vegetables like broccoli and Brussels sprouts have been shown to support liver health. At the same time, try to reduce your intake of processed foods, excessive sugar, and fried foods, which all put extra strain on the liver. Fifth, stay hydrated. Water is your liver's best friend. It helps flush toxins out of your body and supports every function your liver performs. Aim for at least 6 to 8 glasses of water per day, more if your doctor approves. Sixth, stay active. Regular, gentle exercise, even just a 30-minute walk each day, improves blood flow, helps maintain a healthy weight, and supports your liver's detoxification processes. And seventh, don't ignore your feet. Make it a habit to examine your feet regularly. Look at them, touch them, notice any changes. Your feet are incredible health indicators, and they deserve your attention. Let's take a moment to review what we covered today. We talked about 8 warning signs your feet can show when your liver is in trouble. Number 1, persistent swelling in your feet and ankles. Number 2, intense itching with no visible rash. Number 3, yellowing of the skin on your feet. Number 4, red, warm, or burning soles. Number 5, spider veins appearing on your feet and ankles. Number 6, numbness or tingling sensations. Number 7, severely dry, cracked heels that won't heal. And number 8, easy or unexplained bruising. Any one of these signs on its own may have a simple explanation, but when you notice 2, 3, or more of them happening together, your body may be trying to tell you something important about your liver. And here's what I want you to remember above everything else today. Catching liver problems early can make all the difference. The liver is one of the only organs in your body that can actually regenerate, that can heal and repair itself, if the damage is caught early enough and the right steps are taken. That is remarkable. That is hopeful. And that means it is never too late to take action. You have lived 60, 70, 80, or more beautiful years. You have earned every single one of them, and you deserve to live the years ahead of you in the best health possible. Taking care of your liver is one of the most important things you can do to make that happen. So please, look at your feet today. Pay attention to what they're telling you, and don't be afraid to speak up and ask your doctor the right questions. You are your own best health advocate, and the fact that you watch this video tells me you take your health seriously. I'm proud of you for that. Now, before you go, I have a few small requests that would mean the world to me and to this community. If you found this video helpful, please hit that like button. It takes 1 second, and it helps us reach more seniors who need this information. Subscribe to the channel if you haven't already, and tap that notification bell so you're always the first to know when we post new health content for seniors. We publish new videos every week, and every single one is designed to help you live longer, healthier, and happier. Share this video. Send it to your spouse. Text it to your adult children. Share it in your church group, your book club, your walking group. You never know who might be experiencing these symptoms right now and doesn't know what they mean. Your share could literally save someone's life. And finally, leave me a comment below. Tell me, did any of these signs surprise you? Are you experiencing any of them right now? I read every single comment, and I'd love to hear from you. Your stories and your experiences help shape the content we create, and they remind me every day why this work matters. Thank you so much for watching, my friends. Take care of yourselves, take care of your feet, and I'll see you in the next video. Stay healthy, stay informed, and never stop listening to what your body is telling you.